Good day, I'm Dr. Eric Chacon, a diabetologist here in Capital Medical Center. Diabetes is a chronic disease, meaning one needs long-term care. 1 out of 14 Filipino adults lives with diabetes, according to the International Diabetes Federation. The Philippines has 3.9 million total cases as of May 2020, and it is the fourth leading cause of death among Filipinos based on the 2021 Philippine statistics data. Diabetes is a disease that affects how our body utilizes blood sugar, or what we call blood glucose. Glucose is our main source of energy and comes from the food we eat and from our body stores, while insulin is a hormone made by our pancreas that helps glucose go to the inside of our cells to be used for energy. But with diabetes, the body doesn't make enough or doesn't use insulin adequately. In diabetes, the glucose will stay in the blood and doesn't reach the cells to be utilized as energy. Over time, having excess glucose in the blood compartment will cause complications and bad effects to most organs in the body, creating health problems. If diabetes is left untreated, it may cause serious major health problems such as cardiovascular disease, neuropathy or nerve damage, nephropathy or kidney damage, retinopathy or eye damage that can lead to blindness. There are different types of diabetes, each with different causes, but they all share the common problem of having excess glucose in the bloodstream. First is the type 1 or insulin-dependent diabetes. It can develop in any age, but it occurs most frequently in children and adolescents. If you have type 1 diabetes, your body produces very little or no insulin. It means that you need daily insulin injections to maintain blood glucose levels under control. Second, there is type 2 or non-insulin dependent diabetes, which is more common in adults. When you have type 2 diabetes, your body does not make good use of the insulin that it produces. Over time, people will require oral drugs or insulin to keep their blood glucose levels under control. Third is pre-diabetes. Your blood sugar levels are higher than normal but not high enough to diagnose type 2 diabetes. Normal blood sugar must be less than 100 milligrams per deciliter in a fasted state or FBS and 140 milligrams per deciliter in random blood sugar. Pre-diabetes raises your risk for type 2 diabetes. And last is gestational diabetes mellitus, which develops in some women when they are pregnant. This type of diabetes may or may not persist after the baby is born. But if you've had gestational diabetes, you have a greater chance of developing type 2 diabetes later on. Symptoms may vary depending on what type of diabetes you have, but some may include increased thirst, feeling weak or tired, blurred vision, numbness or tingling in the hands or feet, slow healing wounds, sores, or cuts, weight loss, frequent urination, frequent unexplained infections, and dry mouth. Family history may play a part in all types. Age, obesity, or if you are diagnosed with polycystic ovarian syndrome and have had gestational diabetes mellitus in a previous pregnancy, may raise the risk of having pre-diabetes, type 2 diabetes, or gestational diabetes mellitus. Although diabetes is a chronic or long-term disease, it can be adequately managed. As part of self-management of diabetes, it is helpful that you have a glucose meter to monitor your blood sugar. It is also important to change your lifestyle by eating right, exercising, and going to regular doctor's consults and taking your medication. These are typically the first steps towards reducing blood sugar levels. At Capital Medical Center, our highly skilled doctors and certified dietitians will support you with dietary plans and management. With our state-of-the-art facilities and comprehensive medical services, you may take tests for fasting blood sugar, random blood sugar, HbA1c, or oral glucose tolerance test, among others, to know if you are at risk of diabetes. Speak with your healthcare provider. Don't wait until it's too late. For more information, visit our website or Facebook page or call our care concierge to schedule your visit.